It is my pleasure to introduce to you Alexis M. Bell. Alexis is a reporter, media specialist with Spectrum News 1 in Raleigh, North Carolina. She is a general news assignment reporter and is helping her TV station launch a new franchise. And that franchise is called The Little Things Matter. Through this, Alexis is able to tell the stories that are most passionate to her, which focuses on social and economic justice. Alexis is from Newport News, Virginia. She graduated from Woodside High School. She is also a graduate of the University of North Carolina at Chapel Hill. She is a member of the National Association of Black Journalists and also Delta Sigma Theta Sorority Incorporated. Alexis is fun and energetic. Her favorite place to be is at the beach. And when she isn't doing any of the things that I just talked about, she likes learning how to cook new dishes. However, the most important thing that I'm so proud of is that Alexis is my daughter. So I present to you our moderator, Alexis M. Bell.
Hello, hi everybody. I'm assuming there is a huge round of applause going on right now. I'm so happy to be with you all today. Like Sora Sandy Bell, my mom said, I am her daughter, and so thankful that the Denbigh Alumnae chapter asked me to be a part of this virtual event. I obviously think these topics are so important always, and as Sora Kelly was mentioning, especially now, it has been a heightened, exposed part of our healthcare, education, and food and shelter system that definitely needs to be discussed and talked about. So I hope with hearing the panelists and what everybody has to say, you all have something to take away from this. I know we can't see everybody that is tuned in, but I hope you all are engaging. Please ask questions. Of course, we're looking to help you all out. This is for you. This is not for us. So please, we have some questions ready, but definitely want to make sure this is what, it will be helpful for you all that are watching. So I'm going to go ahead and get started, and we're going to start with our healthcare panel. 4 people that we would like you all to meet that will be able to help you with resources in several different areas. To start off, I'm going to have Dr. Ethlyn McQueen Gibson, who serves as an associate professor at Hampton University School of Nursing. Her clinical research focuses on addressing residents' mistrust from communities of color of healthcare messaging and review of COVID-19 testing protocols within public housing in Southern Virginia, and how these protocols can be adapted to be more representative for the people's needs. She serves on the Virginia Governor's COVID-19 Task Force for Long-Term Care and the State COVID-19 Vaccine Advisory Work Group. She's an active member of Alpha Kappa Alpha Sorority Incorporated in Hampton and the Links Incorporated in Newport News, Virginia. So welcome, Dr. McQueen Gibson.
Good morning. Good morning. I always have to say, especially for my sisters of Delta Sigma Theta Sorority Incorporated, I love my deep pink that I'm wearing today for my sisters, but I'm very excited to be here today. Is the screen available for me to share a little bit this morning?
It is, but Dr. Gibson, let me introduce the other panelists, and we're going to come back around. Okay, we have 3 more. Amber Martens, who's going to be on our healthcare panel, who is a director of eligibility and community outreach at Lackey Clinic, which is a faith-based health center for the medically disadvantaged. Amber oversees patient eligibility, the medication assistance program, and collaborates with community partners to improve access to healthcare and improve health outcomes in our community. So please welcome Amber.
Good morning.
Good morning. And Dr. Bane, Michael Thomas Bane is respected HIV and PL-HIV community advocate and resource in his hometown, Newport News, Virginia. Michael graduated from Hampton University School of Pharmacy in 2014. He's currently the pharmacy manager of local specialty at Walgreens, where he works closely with his community to ensure they achieve their best health through medication. Michael Michaels prioritizes empowerment and self-advocacy in his work as it is essential for all, but certainly for those seeking health and intersections of their race, gender, and sexuality. When he's not advocating for his patients, he serves as the director of his Kappa League, a mentor program hosted by his fraternity, Kappa Alpha Psi Fraternity Incorporated. So welcome, Dr. Michael Bane.
Hey guys, thanks for having me. I'm currently on like 2 Zooms, so I'm trying to, I didn't want to miss this because this is very important.
You're so giving to the community. We'll come back around. And last but certainly not least, we have Dr. Camille Carson, who is a pediatric psychology fellow with the Children's Specialty Group with Children's Hospital of King's Daughters. She is a May 2020 graduate of Virginia State University with a degree in clinical health psychology. At CHKD, Dr. Carson works as a consultation and liaison on the consultation and liaison team, providing mental health services to pediatric patients who are inpatient for medically complex needs. She conducts individual and family therapy and psychological assessments with children and adolescents. Her clinical interests include working with Black children and adolescents and pediatric chronic pain. Dr. Carson enjoys advocating for marginalized communities and providing education to parents, families, and social supports for children struggling with their medical health. So welcome, Dr. Carson.
Good morning.
Good morning. Okay, so now that we have you all introduced, and everybody remember, you can ask questions in the Q&A if you already heard something from their bios that was interesting. But I'm going to go back to Dr. McQueen Gibson. I know you were going to start off, but please just tell us a little bit about what you do and what your company is offering. I think you're still muted.
There we go. There we go. Okay. So I'm actually just going to give you just a couple of things to think about here. There we go. At Hampton University, I'm an associate professor. And so what do? I actually am tasked with preparing future healthcare providers to take them out into the community and to prepare them to be those folks that are prepared in the pandemic. So what have we been doing, and what will I be doing later today when I leave this screen? So we are trying to prepare our community of Black and Brown members to feel comfortable and not be hesitant to get shots in their arms. And we know people have lots of questions. So right there, you see Dr. Gibson getting a shot in her arm, because people keep asking me, is it okay? Is the shot good? Will I still be standing tomorrow? Well, I want to tell you that yes, it is okay. And I've had a shot in my own arm. My students, every single one of them, they had the same questions, but each and every one of them have been on the front lines. They have been putting shots in arms of other healthcare providers. People have asked me, what is all this mRNA about? And all of the information that is on the slides here that you see today, it's in I forgot what you all are calling it here, the area where you can go back and check it a little bit later. It's available. So COVID-19 mRNA vaccines, and I think we have a pharmacist here that will be speaking after me. I put a couple of slides here that makes it easy for you to understand. What are all the facts about mRNA? I tried to break it down, make it very easy for you to understand. Everybody's been asking, weren't the vaccines created just really too quickly? That's why I'm afraid. We don't want you to be afraid. Actually, these vaccines were created over 10 years ago. The technology, way back when we were, when you were hearing, for many of you who might be a little bit younger than me, when we were talking about H1N1 and Ebola, we were actually beginning to develop many of these vaccines way back then. We don't have any live vaccines that are in these vaccines that we are putting in arms right now, especially Pfizer and especially Moderna. So again, I wanted to leave you with some of this information this morning. The other thing people are asking me, what are the ingredients in the vaccines? Because again, many people, especially those who are of childbearing age, are afraid of taking the vaccines. They are asking, will they make me infertile? The answer is no. These are the ingredients that are in the vaccine. So potassium chloride, potassium phosphate, sodium chloride, sucrose, okay? If you have questions, here's the information. What are some of the side effects from the vaccine? Because when folks sit in my chair a little bit later this morning, these are the questions they ask me. How am I going to feel after I get the vaccine? I tell them you might have some injection, reaction at the site. Most people, don't with the first vaccine, sometimes do with the second vaccine. 3 weeks later with Pfizer, 4 weeks later with Moderna. You might have some fatigue, you may have a headache, maybe some muscle pain, maybe a few chills, sometimes a fever, and then usually about a day later, you don't even remember you received the vaccine. The reason we're concerned about trying to get the vaccine out in Black and Brown communities is because there is still health disparities in Black and Brown communities. When I look at the statistics, and I sit at the table because I am on the governor's vaccine advisory work group. I was appointed by Governor Northam to sit on that advisory committee. I took my chair, got in some good trouble. And so every Tuesday morning at 7 a.m., I represent our community for the peninsula with Riverside Health System, Bon Secours, Centera Health System, all of the localities. And we sit at the table and we look at the statistics. And believe it or not, right now, when we look at the demographics, don't fall off your chair, but right now, over 60% of Caucasians on the peninsula have been vaccinated, but right now, only 40% of Black and Brown, and that includes African Americans, Hispanic Latinos, and Asian Americans, have been vaccinated. That's a disparity. That's a disparity. 60% Caucasian have been vaccinated, 40% of Black and Brown have been vaccinated. And so that to me means that 40%, that means that the other will be the ones that end up in the hospital that then could be on a ventilator and then could die. So that is why when I leave this program this morning, Dr. Gibson is going to take this cute little jacket off and these pearls, and she's going to go put shots in arms because I don't want to have to take care of somebody on a ventilator because I want to put a shot in their arm. So my message is that I want to keep informing those in my community so that they are informed. So here's the information. Yes.
We have a question in the panel and I want to ask it just because you're on this topic, and I'll ask this and we'll head on to another panelist, but they ask if you have tested positive for the vaccine, or if tested positive for COVID, I should say, when should you get the vaccine?
You can get the vaccine. At least we have you wait at least 3 weeks after you have tested positive. So you can get the vaccine 3 weeks after you have tested positive and you are no longer having symptoms. So very quickly, this is how you can sign up to get the vaccine. This is where I will be today giving the vaccine. You can actually just take your phone, scan, hit that scan right there. I will be at the Achievable Dream High School today until 3 p.m. So that's in Newport News. Please come on by, and Dr. Gibson will be there. And I hope to see some of you. Share this with your friends. Anybody can come on by and get a vaccine. Thank you.
Thank you. And of course, all that information will be in the booth as well. I know you were talking about that, but don't go anywhere because there may be more questions for you at the end of this panel.
I'm going to be here till 9:45.
Okay, perfect. And so I want to go ahead to Amber Martens with Lackey Free Clinic. Please tell us about what you all are doing in the community. And I also wanted to ask you if you all, receive somebody and there's a service that you all can't do there, how can you help them find somewhere that they can go?
So that's a great question. I'm really excited to answer that one. And then we'll get into kind of what we do. But we have charity care agreements with all three of the hospitals. So Riverside Hospital, Centera, and Mary Immaculate Bon Secours. So if there's something that we can't do in-house, we do have specialists that come to our clinic, but we can refer them to the hospital under the charity care agreement. So they can receive surgeries, they can receive MRIs, they can receive that specialist care, they can be sent up to VCU for neurology. They can have all those services done, x-rays, all those kinds of things through us and at no cost to the patient. So we love these charity care agreements that we have with our hospitals. Our goal is to keep people out of the emergency room and make sure that they're getting preventative care and ongoing care. And emergencies are supposed to be the only things that are going into the emergency room. So I thought it's okay if I share the screen real quick?
Yes, thank you.
Back to the beginning. Except it's at the end. There we go. All right. So Lackey Clinic has been providing skilled and compassionate healthcare services for low-income uninsured adults in the Virginia Peninsula for over 25 years. In fact, we're heading almost into our 26 years. And as one of the other panelists was talking about, it started in Lackey, the area of Lackey and Yorktown, at a Rising Sun Baptist Church over 25 years ago. And it was just from the doctor and the nurse who founded the clinic just wanted to give back to the community. They knew that there was a shortage of healthcare and access to healthcare in that area. And so they just asked the church, can we set up here and ask people to come in so we can offer them free healthcare and teach them to be healthier, teach them to take care of themselves and offer these services to them. And it grew and it continued to grow. And now we are just down the street from Rising Sun Baptist, right there in Yorktown. And we have a 2-story building with 10 different medical offices. We have 5 dental bays. We have vision. We have an in-house pharmacy, and we have counseling. And all this is available to our patients in one place. And we do that because the people that we serve don't have time to be going to 5 different locations to pick up their medicine and see their doctor. It costs money when they have to leave work. And we're trying to make these services available to them all in one location and give them that kind of holistic kind of care that we have as well. As also mentioned, we're a faith-based clinic. So we have spiritual care counselors on hand that if somebody wants to come or speak about God or pray with them, we have that availability. But we are also open to anybody of any faith, no faith, and we just want to share with our community all the services that we have. So we have 3 ways for uninsured adults to get the care they need when they need it. We have that full Lackey patient, which means that you get screened for financial as well as medical to make sure we're a good fit for you. And it takes about 3 to 7 days. And that means that you get medical, dental, medications, counseling, vision, all the things that we have. Then we also have Lackey dental only, which is a little bit quicker because you don't have to get the medical approval. And for some people that just want to get in to get their teeth taken care of, that's an option. In addition, if you meet our financial requirements, which we go over in just a minute, you can have Medicare as your medical insurance, but you don't have access to dental. So we can see you for dental only at our clinic as well. And then lastly, our virtual urgent care, we just started last week. This is an urgent care visit with our doctor, Dr. Robertson. It's a low-cost virtual visit, so it has to be done online, so through chat, and it's $30 instead of the $125 that it usually is to do a urgent care visit with other urgent care centers. And we can take care of people, get them their prescriptions, get them what they need through a virtual urgent care, where people can do that on their lunch break at work for super low cost. And then we try and refer them to us so that they continue to get that ongoing care with us. So our eligibility requirements, you have to be medically uninsured with that exception.
Amber,
Yes.
I don't know if it's just my screen, but I'm not seeing the slideshow move.
You're not.
No.
Oh goodness, you need to see this. It's showing on mine. Let me try.
It's
Stop
still in
it.
the Denbigh Alumnae chapter. Somebody has asked in the meantime, and
Can you see that?
yes, we can see
Okay,
that.
that's
Okay,
what-
I'm gonna let you go ahead and finish. Go ahead.
Okay, so eligibility requirements, you must be medically uninsured. So you cannot have medical insurance, with that exception that you can have Medicare for dental only. You have to be 18 or older, and you must live within Newport News, Williamsburg, James City County, York County, or Poquoson. You have to be in the US for at least 1 year, and you have to meet our income requirements. Now, most people don't understand that this is much higher than most people think. So an individual of one, if you're the only person in your household that is in your household, you can make up to $38,640 a year, and you qualify for all of our services. A family of four can make almost $80,000 a year and qualify for our services. This is not for just the very lowest of the income. We want to extend that to the people who don't qualify for Medicaid. They don't qualify for food stamps. They are that in between, and we want to cover that gap to make sure that everyone has access to affordable or free healthcare. Okay, what we're not able to provide is we don't do chronic pain management. We refer out for that. We don't do prenatal care. We can certainly take care of the mother while she's pregnant, but we refer out for OB because we don't have an OB on staff. We don't do substance abuse treatment or treat severe mental illnesses or prescribe narcotics or sleeping pills. And you can go to our website at lackeyclinic.org policies to see our patient policies. Now, to become a Lackey patient, we've created a totally online patient application. You can do it right from your cell phone. You can do it 24 hours a day while you're sitting on your lunch break at work. And you can go right to that website, lackeyclinic.org, new patient, and you can fill out your application and even take pictures of the financial documents we need, and it uploads right there. You don't have to step foot into our office to apply. You can do it from anywhere. Some of the things that we need is a picture ID, proof of address, like a regular bill that comes to the house to show where you live, and proof of income. So 2 pay stubs usually. And then you can submit those, or you can email them to us later or drop them off at the clinic or fax them. And then we have the virtual urgent care. And that, like I said, that's for our non-patients. These are for people who are out there that still have not come to Lackey Clinic, who are uninsured. They can do it from anywhere. And for those non-life-threatening conditions that you need urgent care right away, you can go online, set up your own appointment time, and literally meet with our doctor and get that taken care of. And for that, you can go to lackeyclinic.org/urgent. And then I'm open for any questions for anybody.
Great, thank you. I'm gonna hold questions till the end because we are getting some in,
Okay.
but I definitely do wanna get to our 2 other panelists really quickly. So let's go to Dr. Michael Bane. Oral child, Dr. Camille Carson. I know Michael's on his other Zoom as well. Are you ready, Camille?
Yes, good morning.
morning.
I don't have a PowerPoint to share. I wanted to speak more briefly about mental health as a whole within the Tidewater region. Although I do work at CHKD, we're an inpatient facility. We do offer several different resources within the hospital that looks at that takes a holistic care to medically complex patients. So we offer not just the medical services, we offer mental health, which is typically where I come in to support them while they're inpatient, whether that's with anxiety, depressed mood, things of that nature. A lot of times I'm just being supportive to the medical team that's working with them, normalizing things that would be normally expected in a kid who's dealing with cancer and a kid who's had a trauma, gunshot wounds, things like that, and helping the team better serve that patient so that we're not re-traumatizing that patient or making their anxiety and depression exacerbate with things that we can manage, such as our calm demeanor when we're talking to them, getting down on their level, things like that. We also have child life supports, which also come in, they kind of do like a play work with them to explain medical procedures. They offer opportunities for them to get out of their room and engage with other patients safely in the playroom, teen rooms, things of that nature. And then on the outpatient side, I do individual therapy. My caseload right now is ranging from age 8 up to age 18. We do take individuals all the way up until 21 for therapy. Typically, the route that individuals come in to us for therapy is to get a referral from their PCP or their primary care provider for different areas of concern. A bulk of my work is spent with psychological assessment, where medical doctors, therapists will send their clients to me just to kind of figure out what's going on. Like, these are the symptoms we're seeing. We're not sure what's going on here. We're not sure if we're looking at depression, anxiety, behavioral disruption symptoms, things like that. And especially with the rise of COVID-19 right now, what we're seeing is a significant rise in referrals being made for therapy and for testing, because a lot of kids are struggling with the virtual platform to focus in school. They're struggling to shift from in-person learning to virtual learning. They're also struggling socially, because we are social creatures and our social world looks a lot different right now. So a lot of what we do is helping parents to cope with what's going on with their children, giving them resources and empowerment to help their children, because we're only meeting with them roughly one time per week for 1 hour. Majority of the time is spent with their family members, with parents, with caregivers. So we want to empower those parents to have the skills that they need to address in home and at school what's necessary. That's pretty much it. I'd rather answer more questions than anything, so.
For sure. We're getting to the questions, but I do want to introduce or have Dr. Bane talk to us a little bit about what you do as well.
Oh, thank you so much for bearing with me. I want to say that Dr. Carson, you did an amazing job. But anyway, so as stated earlier, I'm actually the pharmacy manager of the Walgreens specialty in Norfolk, Virginia, located in the Ghent area. I used to be the pharmacy manager of a regular retail store in Portsmouth, and they're actually night and day. In my role that I have now, I reach out more to the community. I make partnerships in the community to try to make sure that we're taking care of patients, or like I like to consider them family, properly. Being that I'm from the 757 Hampton Roads area, I'm actually from Newport News, and work, like I said, work in Norfolk. I feel a lot of times our people aren't being taken care of properly. So my role allows me to help patients in more ways than not. I try to make sure that people feel like people when they come in there, not just a number or not just a sick person. So you get that aspect. We also help with funding with medications that are really expensive. A lot of times people don't think that they qualify for funding for medications because they make too much. When in reality, if you make less than $50,000, a lot of times you'll be able to receive funding for a lot of the funding that's available out there. And again, I think it might even be like almost $75,000, and it goes up the more people that live in your household. So with that being said, it's just a wealth of knowledge and information that's available for everyone. And what I do is I work with the LGBT Life Center, with JT, he'll be speaking later. I just work with a lot of entities in the area, just trying to make sure that we keep people healthy and safe. And we ship, so you don't ever have to go into the store, especially with the COVID pandemic that's going on right now.
Thank you. And obviously for everybody that's listening, these resources are exponentially important to you now, because I know throughout the pandemic, people have been putting other things on hold. It may be mental health or getting medications for other things. So reaching out to these people is so important. All their information should be on the website. So please use that to your advantage. I do want to ask a question, and I think Dr. Gibson answered it personally, but wanted everybody to be able to hear this. Just what's next for COVID-19 as far as people who are vaccinated? Do you foresee, or do we know anything about, will this be a continuous thing in the future? Or for people who are vaccinated, what does that mean? Are we safe from ever getting it again this year?
What's next for COVID-19 is starting April 18th, is that we will be moving into phase 2. which basically means that everyone 18 and older, it will open up for everyone to be vaccinated. The next biggest thing will be that we are hoping to begin vaccinating all of those who are leaving college. I know that there's been a little glitch with Johnson & Johnson. So we had hoped that everyone who was leaving college would be vaccinated as they were leaving college. That was the plan. So all of our students at CNU and William and Mary and Hampton University, we were hoping that we would vaccinate them as they were leaving college. So more to come on that, so that they wouldn't leave college and then go home and infect other family members. We are also hoping that as students are returning to school, that they would also then be vaccinated, especially those who are 16 and older. The other piece is that you've seen that FEMA has been setting up centers, whether that's in Norfolk, that's in Portsmouth. That's going to be very, very important for family members to get out and get vaccinated. The other piece that people might not know is that FEMA also now has dollars. If you have family members who pass away and their diagnosis is related to COVID, there is money available to help with funeral expenses, up to $5,000. And funeral homes are aware of how to get you reimbursement for those dollars. FEMA does have dollars available to help family members with reimbursement for funeral expenses, because that really hit our community. So I do want to make sure that people are aware of that, and most of our funeral homes are aware of that also. We probably will be getting a booster every year, just like we do for the flu. So that will also be on the horizon also for COVID-19 every year.
Thank you. And for Lackey Clinic, we're asked, what basic needs do you meet or do you provide for the community on a day-to-day? What can somebody come in today and get? And also, do you all need volunteers? Can people volunteer there?
Yes, so we definitely are always looking for volunteers, medical and non-medical. If it's medical, you do need to be licensed in the state of Virginia, but we have admin, we have people who help with our medication program. Just as the other doctor was speaking of, we gave over $8 million worth of free medication to our patients last year. So $8 million, because people don't realize they can get these brand name drugs for free. And so we can order them and they can come right to our pharmacy to pick up. So you can volunteer in also in the pharmacy and help with pharmacists with bringing those medications in and making sure they get labeled and sent in correctly. There's many, many different volunteer opportunities, including some virtual opportunities for those who are still uncomfortable coming into the clinic during COVID. For what we offer medical, specialty care, dental. So for dental, we can do cleaning, extraction, x-rays, exams. We do a little bit sometimes with root canals on patients who are keeping good oral care going on. We do the oral screenings. We have the whole pharmacy department, so generic drugs plus the brand name drugs. We have vision and the free eyeglass program. We have our counseling, which is done all virtual right now, and then some psychiatric care that we can also give as well.
Great, thank you. I have time, I think, for maybe one more question. We'll see how it goes. I want to talk to Dr. Carson. I know you deal with mental health a lot, and especially children. How can parents at home know the signs or know to reach out? What should they look for in their child, especially right now?
Yeah, so a lot of changes are going on with our children's behaviors and their social interactions at home. The biggest recommendation that I have is, you're the parent, you're the expert. If you have a concern, feel free to voice that to the medical providers that you're working with, whether that's the primary care doctor to have a referral placed, things like that. One thing that I've noticed in the care that I'm providing is parents are attempting to advocate for their children, saying like, hey, I think something's going on. I can't really put into words, but my child's different. And sometimes medical providers are like, oh, that's fine, and it is okay to push back against that and say, hey, I want to hear from a mental health professional. And if they say that everything's fine, that's great. But let's go to the people who really know about that. Right now, the big areas of concern that I'm seeing are anxiety. That's the big one. There's a raise in autism, and then also attention deficit hyperactivity disorder. Those are the three things that are big concerns since COVID has hit. The first one, anxiety, what we tend to see when we first talk about our younger kids is actually irritability. Anxiety looks very different in our kids. In older people, we may see more nervousness, jittery, things like that. In our children, we see more irritability. So, for example, if your child is typically more mild-mannered, and now you're seeing kind of like flying off the handle very quickly at small things, the response is outside of the proportion of what you would expect to the situation. They can't get their favorite food and they're falling out for 3 hours, and that's not their norm. That would be a big concern. Some kids are just more quiet, and that's okay too. What the main difference is, if there is a shift for your child in their behavior. With autism, I think a lot of parents are starting to get concerned just because our social dynamics look a little different, and the nuances within our social world is very different too. We're relying on a lot of facial expressions right now. So parents are starting to realize that their kids aren't understanding those nonverbal cues. So some concerns when we're talking about autism would be lack of shared enjoyment. So if you're engaging with me in play or engaging with me and I make a joke and it kind of just doesn't register on your face that you understand that a joke is being made, understanding metaphors, understanding similes, things like that, or exaggerations in speech, those are also areas of concern. That's the first part of autism. The second part is the repetitive behaviors, stereotypic behaviors. What we're talking about here is those repeated sensory movements when there's too much information coming in, when the child is trying to cope with those symptoms. So the common symptom is hand flapping, but that is not always the primary symptoms we see. Sometimes you'll see kids kind of zone out. Lip picking, skin picking, things of that nature fit into the repetitive behaviors category. The third thing, anxiety, autism, behaviors. I think that's the big one. Behavioral outbursts can look from destroying property to being more physically aggressive with their siblings or verbally aggressive. A lot of the recommendations that we have here are kind of setting healthy boundaries for our children and redirecting them to something else. So if they're frustrated because, I don't know, I can't get my homework done and I don't feel like I have enough help, normalize that it is okay to get frustrated. We all get frustrated, and then allow them to shift to something that will bring that emotional dysregulation down, and then redirect them to the activity. The important thing is to not allow our children to avoid so many things that are causing disruption, but to take a break from those things. If we allow them to avoid, we're actually increasing this chance that they're going to keep continuing to avoid those things moving forward. So if homework is an area of frustration for me and I'm constantly avoiding, now I'm going to start school avoidance, and that's going to end up affecting me in the long run. But yeah, and there are tons of resources that I also placed on the resource sphere bank that talk about some coping skills that parents can assist with, some warning signs and different parent management techniques, because another thing that we're seeing is there's a shift that is happening in understanding how to correct our children's behavior from more physical to more verbal and emotional responses, where we are redirecting their behavior, normalizing their feelings, and directing them to a new task versus yelling and aggression, which actually teaches our kids that that's the way to respond when there's an upsetting stimulus. So yeah, those are some great resources on there.
Yes. And I know people still have questions, and Kelly put the link in the chat, but please go to the website. This isn't the end of these professionals' engagement with you all, just the beginning. So reach out to them, ask those questions. I know you all still have some 4 people in particular, so please reach out to them. And thank you, panelists, for sharing with us today. Big round of applause virtually from everybody at home. And we're going to head into our first break. I know there's some raffle prizes for you all for joining in and so many other panels that we have to get to. So thank you, healthcare panelists.
Thank you for having me.
Thank you.
All right, as Alexis, our moderator, mentioned, we are going to move into some raffles because what's an event without winning prizes? So we have Christy Norwood, who's going to pull up our wheel of names. And we have some wonderful prizes for our attendees. So hopefully registered early for your chance to win.
All right, so we are super excited to be able to start our raffles. We'll have some right now, and then we have some later on in the program, so be sure to stay around.
Here we go. Spin the wheel. And we have Charlotte Jacobs as our first prize winner. Charlotte, you are the lucky winner of a $10 Starbucks gift card, so congratulations. All right, let's spin that wheel again. Close. Congratulations, Arabia Johnson. You are the lucky winner of a $25 Bath and Body Works gift card. All right, congratulations to Carlin Lucas, who is the winner of a $25 Walmart gift card. All right, and congratulations to Charmaine Chisholm for a $10 Panera gift card. A close one. Congratulations to Carla Smith for a $25 Food Lion gift card, and we have time for one more. It's a close one. And congratulations to Michelle Williams for a $10 Chipotle gift card. And stay tuned, we have more gift cards and more information available to you. We'll have a brief commercial break. So if you just hold tight and we'll get ready for our next panel. Thank you. All right, so we'll move into our next panel of speakers, and Alexis Bell will introduce, but we'll move into our education panels with the introduction of our panelists, our speakers.
Are we going to food and shelter or education?
Yes, I apologize, sorry.
Okay, I just wanted to make sure if you wanted to switch it up, fine by me.
No, let's stick to the plan.
Okay, sticking to the plan. Welcome back, everybody. I should have registered under an alias and got on that raffle board. But welcome back, everybody. I hope you enjoyed your little break, and we're going to get into our food and shelter panel. So we have 4 dynamic panelists for you, and please remember to ask questions in the queue, even if you hear something in their bio that piques your interest at the top. So we're going to start with Charvalla West, who is COO and Director of Community Impact at United Way of the Virginia Peninsula. Charvalla leads the organization's efforts to support the nonprofit community and bring various sectors together in order to create pathways out of poverty. After a 10-year career in sales and marketing, Charvalla began serving as a volunteer and eventually a paid staff member at Avalon, a center for survivors of violence. It was there that she saw firsthand how it takes people and organizations working together to make a difference in the lives of individuals and families. Since joining the United Way organization in 2015, Charvalla has worked diligently to improve access to resources for people in need and bring the community together to move people out of poverty. By creating ways to give, telling the stories of poverty on the peninsula and the work of our partners to serve, and by supporting critical partnerships and collaborations, United Way provides opportunities for each of us to contribute and be a good neighbor. Charvalla is currently focusing on expanding the services of the Community Resource Center, a relationship-based information and referral network, and implementing the newly awarded Virginia Eviction Reduction Pilot Grant. So please welcome our panelists.
Good morning. Thank you for having me, and thanks for the introduction.
Yes, good morning. We're going to introduce Karen Joyner with the Virginia Peninsula Foodbank. Karen Joyner has been the Chief Executive Officer at the Virginia Peninsula Foodbank since April 1st, 2013. Prior to that, she was the Chief Financial Officer at the Foodbank of Southeastern Virginia in Norfolk for 9 years, and was on the board of directors in the Foodbank from 2001 to 2004. Karen is a graduate of the College of William & Mary, and she was in the public accounting at the KPMG firm for several years upon graduating and passing her certified public accountant exam. In December of 2006, Karen was selected for a Woman in Business Achievement Award by Inside Business. She was also named as a Super CPA in Virginia Business Magazine in the nonprofit category in 2006, 2007, and 2009, and was named the CFO of the Year for small nonprofits by the magazine in June 2008. In 2019 and 2020, Karen was included in the Inside Business Power List and the Leaders Helping to Shape the Future of Hampton Roads. Besides her work locally, Karen has been active on several committees of Feeding America, the network of food banks around the country, which is headquartered in Chicago. Karen is active in her church as a kindergarten Sunday school teacher. She lives in Southern Norfolk with her husband of 35 years. Karen is a 2017 graduate of the Civic Leadership Institute. So welcome. Is Karen with us?
Yes, thank you so much.
Okay. Hello.
I was just listening to my own bio.
Right. Shocked by anything, or it sounded good?
Well, except I live in northern Suffolk instead of southern Norfolk.
A little switcheroo. Okay. Northern Suffolk. Thank you. Thank you.
I'm just over the bridge.
Just over the bridge. Sorry about that. We have JT Williams with the LGBT Life Center. He is known also as German chocolate, worthy of noting there, is a health advocate for informed quality of health for all. As a graduate of East Carolina University, he has been working in the health education and promotion field for over 15 years and in the human health and service field for the past 20 years. JT's goal is to enrich the quality of life for all communities and beyond through his creative and charismatic personality. Live and in charge, German chocolate is good for the heart. I know that's right. Stay tuned for all of the latest updates from this agent of change. While serving as a community health navigator with the LGBT Life Center, JT's role is multifaceted as he caters to the needs of the people through testing, counseling, linkage to care, and other referral services within and beyond the agency. So welcome, JT.
Thanks for having me.
Hello. We have Francine Lankford with THRIVE Peninsula. She is a paid board member, a current financial coach, and a marketing volunteer for THRIVE Peninsula. She is the business owner of Simply Francine and an important insurance agent. Francine's ultimate goal is to be able to help those in need, and she believes the first way to help is to show love, kindness through your voice and actions. So welcome.
Good morning.
Good morning. I'm so happy to have you all with us today. Kind of going to do something similar to what we did with our last panel as far as just giving us a little bit more detail about what you do. But I do want to also touch on what can people who are watching right now benefit from today or this week, maybe a month from now, that you all are doing or have going on. So please, I'm going to start with Charvalla West.
Thanks. So I would say first, I did send for the resource fair, the information for our current information and referral services. For the Newport News and Hampton area, we have a partnership with Riverside to administer first call for help. It's, as I mentioned, an information and referral hotline. They are great at connecting people to resources in the community, particularly those for food needs. So you can definitely call them and they'll give you the phone numbers for different partners in the community that are providing different services. For the upper part of the peninsula in Greater Williamsburg, we administer the Community Resource Center. So if you or anyone you know is in need, you can reach out to either of those resources.
Great, thank you so much. Karen Joyner with the Virginia Peninsula Food Bank.
Yes, thank you. Well, the food bank has been in existence for 35 years and a lot has changed over that time. Most recently during COVID, we saw over 265,000 visits to the food bank, one of our partner agencies or programs. So we are always available to provide food assistance for those who don't know where their next meal is coming from. The way we operate is for individuals to either call us and we will direct them to our next mobile food pantry that is taking place up and down the Virginia Peninsula, or we will direct them to our website, which is hrfoodbank.org, where they can put in their zip code and find the latest listing of our partner agencies in the community so they don't have to travel very far. One of the latest projects that we're working on is an attempt to make sure that when we distribute food, we're doing it with an equity lens. And so we are building collaborations among our partner agencies, specifically in 4 locations where we've identified that there's a large disparity between people of color and white individuals in the percentage of food insecurity. And we're making sure that we have adequate resources going towards those areas. And that includes purchasing refrigerator and freezers, having the partner agencies work collaboratively, and most recently we have purchased a lot of culturally appropriate foods, which is kind of fun because we depend so heavily on donated food. And this time we went thinking out of the box. We found out from our partner agencies what are some of the foods that they would like to see us distribute. And we have purchased several $100,000 worth of those foods So those are just coming in now, but we are going to have those on our agency shopping floor for our agencies to access those. And we're also going to share them specifically with the collaborating agencies and specific areas such as the Berkeley Senior Housing Complex, where we do monthly mobile pantries, and there's a large Korean population. So we have a lot of specialty foods that the Korean population has asked for. And so that's kind of exciting because there's nothing more dignified than being able to choose your own food. So we're trying to make our food selection more culturally appropriate and more like choice of what individuals would choose if they had adequate resources to choose their own food.
Absolutely. Thank you. And JT, German chocolate to the stage.
Hello. Hi, everybody. As mentioned, I'm JT German Chocolate Williams. I work with the LGBT Life Center. So I'm here to talk about our housing program, but I'm also here to educate everybody about our additional services. The LGBT Life Center wants to be your #1 primary place of comprehensive care. We do food assistance, we do housing assistance, we do mental health counseling, domestic violence, intimate partner counseling. We have a clinic, we do testing, we do a lot of services, and a lot of our services are free. When it comes to housing, our housing, we have different programs for different populations. You know, we help the LGBT IA plus community. There's a lot of letters. Hey, we're here for everybody. But then it's also, we help individuals who are HIV positive. We also help a lot of youth. And then a lot of people don't understand that if you are not in any of those categories, we can still help you. And because we're partnered with so many organizations within the 757 area, we can go ahead and partner you with some of the other resources that we have. There are some, terms of eligibility, depending on your financial situation, proof of residency, just to show you're a Virginia resident, because we definitely want to make sure the residents of Virginia are, taken care of as well. We definitely, I'm telling you, it blows my mind at some of the things that we can do, because just think about it. If you came in, you didn't want to get tested, but you had a food insecurity. Well, we have a Pride Pantry where you can go get food, but then let's say, oh, I need housing. Boom, you get housing. So you got housing and you got some food. So it's like, wait a minute, time out. I'm living my best life. And that's what we want people to do. We want people to be educated and help enrich the quality of life for not only themselves, but their communities. Because, as Dr. Michael Bane was going to say, it's always important to get a second opinion, but it's also important to, invest in your health. And that's why, partnering with Dr. Bane and Spaces for Healing and other organizations, it's really important, because we want to approach that holistically, that yes, housing was your issue, but they have other issues that you need to address. So I'll be here all day. If you have any other questions, let me know. We have a pharmacy, you name it, we do it, and we do it well. So I'm just here.
Great, thank you so much. And yes, everybody, please remember to ask questions in the Q&A. I'm gonna go ahead over to Francine Lankford. Please tell us about what Thrive Peninsula is all about, what your business, Simply Francine, is, and how you can help, how people can get involved with you.
Good morning. Good morning. It is such a pleasure and an honor just to be one in the land of the living on the day, and also to stand and stay of Angela York, who is the director of Thrive. I've been volunteering for Thrive probably for 5 or more years. As far as part of my bio, it kind of came along across a little muffled, but I am a former board member of Thrive. Once my business soared, I'm now actually located in Patrick Henry Mall here in Newport News, Virginia, on Jefferson Avenue. I have a kiosk in the food court, and it says Simply Francine. That business entails purses, jewelry, hoodies, t-shirts, all kinds of things. So if you're in the Patrick Henry Mall area, please come in and see me. I'm currently a financial coach, so I still volunteer for Thrive. Thrive originated in 1973. Now we're like so big here in Denbigh on Ward Boulevard. I do have a little, some little things that nuggets that Angela did want me to leave. I want to do that first, so I won't get off track. We do have a food pantry. Matter of fact, we have lots of food. So if you know anybody who needs food, please tell them to just call us at 757-877-6211. We give out enough food for 7 to 10 days. We offer produce, meat, dairy, and many more options as well. No income requirements. We don't ask any invasive questions. One of the things that I love about Thrive is that every 30 days you can come by and get food. Another thing I love about Thrive is that you actually get to come in and shop for your own food. Even during the pandemic, we would just call our clients and say, hey, this is what we have available. So you get to actually pick what you actually want to eat. So if you don't like oodles and noodles, we don't give you oodles and noodles. And that actually also help avoid food waste as well. As far as the financial assistance, we aid in household bills as far as rent and utilities. Now Thrive, because we've been so blessed by monetary donations, basically anything that you feel like you have a need for, whether it be car repairs, whether it be child care, whether it be any other things that's critical to you being able to sustain your life, you can request it and it will actually be considered. So if you have a car repair and you have half of the money and you need the other half, we'll even assist you as far as that. And all you need to do to receive that assistance is apply online through www.thrivepeninsula.org/help, or either you can call us at our office 757-877-6211 and just press the number 1. Financial coaching is required. We can assist you within 3 business days. So a lot of times if you have rent issues, we actually have a good relationship with our local apartment managers, even our private renters. We have a good relationship with them. We can a lot of times get a lot of your late fees waived. We can, hold up any court proceedings by just, being in connection with those persons. As far as your utilities, we have a great relationship with the utility companies. We just pay those through our website. So definitely normally within 3 days, we can take care of whatever financial issues that you have. She also wanted me to mention that we are helping Minister Burt, which is BERP, but she said that United Way would explain more about this particular program. We also have financial coaching. Our coaches are volunteers. I'm a financial coach. I am a volunteer. We also see you through a training program through the Virginia Cooperative Extension, which is 20 hours. Through this program, we help our clients build budgets. We help them with a debt plan. It's definitely a no judgment zone. So when you come to get assistance, we don't just hand you some money or hand your the people that you owe some money. We also try to help you look at what actually brought you to Thrive. And also, Thrive is not a revolving door. Normally, when you get assistance, you can only get assistance once every 2 years. So once every 24 months. We also have a 3 appointment like basket, where if you come in for 3 appointments, we actually give you a basket, and the basket includes things like toiletries, things that you wouldn't normally be able to get with like food stamps. So that's an incentive to have you to come back to get more information in reference to your debt resolution. We also have job preparedness. So if you're a person out looking for a job and you've never put together a resume, we actually work with CNU. We have a young lady who comes over and actually help you with your resume. She actually gave me some help as well. We usually do have job postings that's actually within the community. If somebody comes in, we'll let them know, hey, let's say Walmart distribution center is having a job fair on Tuesday, whatever time and whatever date it is. We also help our clients with getting their birth certificates, with getting their ID. So we also have their social security card. We have a young lady who that's what she actually do, volunteer, and she's a board member as well. And that's what she does. Anybody come to us and need assistance getting their legal documents, we help them as well as that. We also have translators. So we use CNU for a lot of our translators as well. We don't have a financial coach who can't speak English and can't speak, Spanish, then we'll have a translator come in for that particular appointment. And finally, we're always looking for partners. We're always looking for people to help along the journey as far as our funds. A lot of people always say, well, how do you all get your funds? One, we partner with over 90 plus churches. If your church is not involved with Thrive and it's here in Newport News, Hampton, and we York County and Pocosin area, we would love to have you to come in and partner with us. Another way we receive our donations is through first private people like you and I. You can go to our Facebook page and just hit the donate key, or either you can actually call into the office and give your information over the phone, and we'll take your contribution that way. And then we'll also get contributions through just the government or the state or the city. We are a faith-based 501(c)(3), so we don't take any donations if we're not allowed to say God or Jesus. I personally open up all my financial counseling sessions with prayer, and I end with prayer. And sometimes it's been amazing. Sometimes people need prayer more than they actually need the food or the money. You know, we've received numerous emails back saying, "Hey, just thank you for the prayer." So that is what Thrive do within the community. We're definitely, I love volunteering for Thrive. I love the volunteers. We are just an organization that really help people, and really, it definitely is a no judgment zone. We really meet people at their needs. And if you all have, definitely visit us in the virtual room. Thank you so much.
Yes, and I just want to ask you a quick question while we're with you. Somebody asked, is there a range for your services, an age range?
No age range, no income range. You know what I mean? We service a lot of people who have just lost their jobs. So just call 757-877-6211. And you know, you can visit our Facebook page. You can call me personally. My number is 757-593-0917. I know Thrive like the back of my hand. So I love that organization. That's why I give my time freely to them. So yeah, so you can be personal, go to my Facebook page, Francine Lankford, and ask any other questions that you may have as well.
Thank you so much. And Kelly put that number for Thrive in the chat. So anybody who wants it, definitely look for it there. German chocolate. A lot of people have questions for you. We know about your Norfolk location. Are there any other satellite locations in the peninsula? And also, are services open to anyone, or do you all keep it just to LGBT QIA community?
Awesome. So before COVID, we were in the peninsula. We had an office in Hampton. However, because of COVID, we had to change some of our restrictions and some of our guidelines. However, we do service everyone in the 757. So whether you live in Newport News, whether you live in Yorktown, I just found out about this other place I ain't never heard of. I was like, whoa, dangerous, because I'm not from 757. So, you know, we come out there. We have coworkers that go to Franklin. We really want to make sure that everybody understands that, you know, this is a, universal service for everyone. When I say everyone, yes, we do service the LGBTQIA+ community. However, we do service everyone. So we don't turn anyone away. Some people may come in and like, oh, I don't want to go to here. That's that gay place. No, we are just a place that wants to help and service everyone. Ironically, today is National Youth HIV/AIDS Awareness Day. So, this is just a day to educate youth and educate those around you to talk about getting tested, talk about testing, talk about, just the commonalities of destigmatizing testing and HIV, because unfortunately, HIV doesn't discriminate. People do. And it's really important, to have these community resources, because if we can't do everything, we're going to go ahead and call Thrive. If we can't do it, we're going to go ahead and call, the Foodbank, and this is the partnership that we need to see in not only our communities, but nationally. That way we could be people helping people instead of people hurting people.
Thank you so much, JT. And no sweat that Yorktown wasn't on the radar for the 757. We who live here also understand. And we have a question, particularly for the Virginia Peninsula Food Bank, but I feel like you all can touch on it who have food bank services. I know Karen was saying you all were getting some diversity in your food as far as cultural, but people asked, what about dietary issues like vegan options as well? Anything like that at your food bank?
Well, while I was listening, I was pulling up that list that we've ordered, and some of them do qualify more as vegan. Somebody else would be a better judge of that, since I'm a meat and potatoes girl, but some of the ethnic foods that we have recently ordered, and most of them have come in, include milk alternatives such as shelf-stable Lactaid, almond, and soy, dry pinto beans, dry kidney beans, dry lima beans, canned collard greens, canned yams, cornbread, biscuit mix, rice noodles, soy sauce, fish sauce, seaweed products, bamboo shoots, ramen noodles. I'm going to pronounce this wrong. Gochujang paste, shrimp paste. For the Hispanic population, we've ordered cilantro and some jalapenos, some canned pork and Spam, tortillas. And then we also include among the underserved population, the homeless population. So we are specifically sourcing some shelf-stable, microwavable meals. So, you know, we depend on donations. And if we have any vegan options, if our partner agencies come, they would see those on the shopping floor. But some of those culturally appropriate foods that I just mentioned would probably qualify as vegan as well.
And just for us in our food pantry as well, we do have some of those same options, as well as we do get some food, frozen meals donated by different churches that are already prepared that we can give, you know, to different populations, including the homeless population. And we also had a contract with Black Dog Cafe to, you know, where there were some more prepared meals. Because we, like you said, we do have to recognize that everyone is not a meat eater. So having these different options that doesn't, you know, increase the food insufficiency in others, you know, is really the best bet. But we also help people sign up for the EBT as well as insurance. So, you know, let's say if you need to sign up for food stamps, we can help you walk you through that process. That way you can go ahead and start that process and get the information that you need. That's one less resource that you have to worry about.
Great. Thank
and
you.
as far as Thrive, because Thrive do partner with Food Line, so we get lots of food from Food Line. So definitely, we have many options as far as somebody who needs vegan food.
Thank you. And this could be for anybody in our food and shelter panel, but obviously with what's going on right now, and I've done plenty of stories on how numbers are growing with so many more people needing food assistance or needing somewhere to live, people who may not have thought they would be in this situation before. So if somebody is watching that may be on the cusp of struggling, but maybe doesn't want to reach out, it feels like I'm not the type of person that need food from a food bank. Have you seen those type of things? You know, how can you help, or what can you say to people that may be in that situation?
Hi, I'll start with an answer. One of the things that we have been doing at United Way since 2018 is really expanding how our community talks about poverty. And one thing we know about COVID is that it's really shined a light on vulnerabilities and disparities that were already at play, that maybe were on the back burner, issues falling and populations falling through the cracks. One of the ways that we talk about poverty and the people who are facing needs from one month to the next is by using an acronym called ALICE. ALICE stands for Asset Limited, Income Constrained, Employed. Folks who are working, sometimes multiple jobs, sometimes jobs that require higher levels of education or training or skill, and oftentimes make too much for mainstream benefits like EBT or childcare benefits or things like that, but still don't make enough sometimes to make their monthly expenses. Sometimes they can get by month to month, but definitely don't have enough to save. Maybe don't have generational wealth or wealth in terms of home ownership that they can rely on and fall back on in times of urgent need like we've seen over the last year. And so one of the things that you'll hear a lot, and you've already heard a lot from the panelists, is the idea of partnerships, whether it's a agency you partner with regularly or relationships that make your business model work, like with us and the food bank. We both use the term partner agencies. These are organizations of all different types that are serving the community in various ways. And so what we've heard from all of our partner agencies is, especially when the pandemic first hit our community in a real big way, before there was any real government response, the community had to come together to address the basic needs that our neighbors were facing. And I would love for Karen to share more about what they saw in the food bank lines and the ways that they adapted their service model to get food out to the hundreds and thousands of people that had never needed food before. And so I think, just again, in general, there's an entire population of people on the peninsula who are working. They're well above that federal poverty level, but they're still struggling to make ends meet. And so for us at United Way, providing those central points of resource navigation can help people understand what's available to them, what they might be eligible for. And the nonprofit community in general, especially organizations like Thrive that rely on donations from faith groups and individuals and don't have the same restrictions and parameters, can open up their services to people that otherwise would not qualify for benefits.
Great, thank you. Karen, did you want to jump in and add on that? We have time for probably that last bit.
Sure. That was a great thing for Charvalla to tee up to me, because even before COVID, there was always a level of individuals who don't qualify for the federal programs. And so they're not counted in the number of food insecure individuals. Prior to COVID, food insecurity was running 12 to 13% of our total population, and we serve 9 cities and counties across the greater Virginia Peninsula. During the height of COVID, it jumped to about 16.6%. But those people that showed up in our lines, they may have already needed our assistance prior to COVID. Prior to COVID, hunger and food insecurity was often hidden. We had our, what we call mobile pantries, actually indoors, and our partner agencies served people indoors. Once COVID hit and we had to change our model to be safe for our volunteers, for the people we serve, for our staff, everything had to be outdoor. So it was no longer hidden. So when the news organizations started showing those long lines of people coming to food banks and food distributions, some of those people had already or always received our services. It was just hidden, and it wasn't included in the food insecurity numbers. But I always say there's a certain number of episodically food insecure people that just need a little help now and then, because either their car breaks down and they need it to get to work, or they have a medical bill that they can't afford. So there's always been a level of food insecurity that's been hidden, and now it's come to light thanks to the media showing that not everybody can make ends meet. So it's getting under control temporarily because of all the resources that are currently available, such as the pandemic EBT for the children, the stimulus checks, tax refunds. This time of year, we always see our numbers drop because of tax refunds. SNAP benefits have been increased by 15% temporarily, and then you have the extra unemployment. But we expect the numbers to go back up as soon as all of those programs are come to an end. So there's always going to be a need, whether it's hidden or whether it's outdoors in line in the cars. And as far as confidentiality, in a way, the fact that people are driving to get to food assistance, whether it's us or our partner agencies, because they've changed their models too, I think there's a little more anonymity when you're in a vehicle and all we ask for is your last name and your zip code. It's a little less daunting than coming completely face to face in front of somebody asking for information. So I think that's helpful as well. I hope that answered the question.
Yes, for sure. Thank you so much, Francine, Karen, Charvalla, and JT. Thank you to our food and shelter panelists. Virtual hand clap for you all. Of course, their information, like everyone else's, is going to be in the booths on the website that Kelly's putting in the chat for you all. So please take advantage. They seem to be so willing and open. So I hope you all are able to use and take advantage of those resources if you need them. Thank you, panelists. We're going to head into our second break. More prizes to be raffled off. So I'll see you all in a few more minutes.
Yes, thank you. All, as our moderator mentioned, Alexis Bell, we're going to move into some more prizes. So hopefully you all are attentive. And Chrissy, if you could spin the wheel for us. All right. So we have Mark Anthony Tynes, who is a winner of a $25 Target gift card. And congratulations to Carrie Mitchell, winner of a $10 Starbucks gift card. On the line there, we have Princess Walls. Congratulations, you're the winner of a $10 Panera gift card. And Celeste Chapman, you are the winner of a $10 Chipotle gift card. We have the Alonzo Bell, winner of another $10 Chipotle gift card. And our last raffle for this section, we have Sharon Williams. Congratulations, Sharon. You are the winner of a $25 Bath and Body Works gift card. So congratulations to all of our winners. We will be sending these raffles to you via email, so make sure you check your emails for your prizes. All right. And we will have a short break. So take a minute to run to the restroom, get something to drink, but please come back. Our next panel will be on education and virtual learning resources, which we know have been very, well, we've needed a lot, especially for our school age children to make these transitions. So make sure you come back, check out our commercial, and we'll see you in a few minutes. Okay, we are back from our brief commercial break. We are again moving into our next panel, which will talk about education as well as virtual learning resources. So I'll turn it back over to Alexis to introduce our speakers.
Yes, welcome back everybody. Our final panel on education, and we have another group of panelists for you with lots of resources. So we'll start with Frances Devaughn, who is a coordinator of student services in the York County School Division. She has over 16 years of educational experience prior to her employment at York County School Division. She was a special education lead teacher in Newport News Public Schools. Mrs. Devaughn has taught a range of grade levels from early childhood special education to secondary special education. Prior to her arrival in Newport News, Mrs. Devaughn resided in her native Philadelphia, Pennsylvania, where she began her first career in vocational rehabilitation or counseling. Mrs. Devaughn has always valued education and has obtained a Bachelor of Science degree and rehabilitation education from Penn State University and Master's of Science degree in special education and an educational specialist degree in educational leadership and supervision from Old Dominion University. Mrs. Devaughn has a simple life goal of helping others and bringing joy into people's lives. However, the source of her greatest joy is her husband of 27 years and her 2 sons and 2 daughters, one newly joined the family by marriage. So welcome, Mrs. Devaughn.
Good morning, everyone. It's a pleasure to be here.
Good morning. Our second panelist, Dr. Candice Artis with Candid Consulting. Dr. Artis is a native of Southampton County, Virginia, and has worked in the field of education for over 10 years. After earning her bachelor's and master's of science degrees in biology, Dr. Artis had the opportunity to serve as an adjunct biology instructor at Shawan University, Paul-D Camp, and Tidewater Community Colleges, and currently adjuncts at Thomas Nelson Community College, teaching a variety of science courses. In addition to teaching on the collegiate level, Dr. Artis also serves as a high school and dual enrollment biology teacher with Southampton Community Public Schools. Her true passion is helping underprivileged and underrepresented students succeed, and she has gained a wealth of experience in assisting students to fulfill their personal and occupational goals by serving as a liaison for students and their families with numerous colleges and universities. Finding success in this area, she started her path to entrepreneurship and is the owner of Candid Consulting, an educational consulting firm that specializes in assisting clients to realize their truest potential. In a world that is filled with opportunities that are seemingly not accessible to the disenfranchised, it is her goal to continuously change the trajectory of people's lives and their families one by one. Welcome, Dr. Candice Artis.
Thank you so much for having me.
Hi. We have with us Jamel Hodges with the University of Georgia. Dr. Hodges was born and raised in North Augusta, South Carolina. He is an assistant director of programming within multicultural services and programming at the University of Georgia. He is a 2011 graduate of the University of South Carolina at Aiken with a bachelor's degree in middle level education. He began working at Augusta University in 2012, where he completed a Master's of Public Administration program and a Doctor of Education program. His passions revolve around issues concerning diversity, equity, and inclusion. This is highlighted in his dissertation as he sought to strengthen the African-American student experience in a university setting. Welcome, Dr. Hodges. All right, we'll head over to Lisa Taylor with Virginia Career Works. Lisa Taylor is a community relations coordinator for Virginia Career Works and WIOA. She has been with the workforce development for over 18 years. She has extensive experience in human services. Lisa serves as an effective outreach liaison between Virginia Career Works, job seekers, individual clients, partners, the business community, and various agencies. Virginia Career Works Hampton Center serves over 25,000 job seekers and over 400 employers annually, preparing job seekers for employment and matching skills with workforce needs. During her husband's 31 years in the Navy, Lisa has been a volunteer in supporting the military and their families. She was a Navy Command Ombudsman for 2 aircraft carriers and was the Comnaverlant Force Ombudsman for 2 admirals. Her greatest passion, besides her family, is helping others. You have a true success in life when you get paid for something that you love to do. So welcome, Lisa Taylor.
Thank you. I'm very honored to be here. Thanks.
Yes, thank you so much for you all being here. I would like to start with Francis. Devaughn, please just tell us what you do, and I guess in the climate we are in now with virtual learning or people transferring back to the classroom, what has that looked like?
Well, good morning. I'm currently a coordinator of student services at York County School Division, and I basically assist particularly students with disabilities, making sure that their IEPs are compliant and that they're receiving the services that they need. And we do that through supporting teachers as well as family members and administration in general. But today I'm going to share some hints and tips for parents to support their children in the virtual learning environment. Most of these tips are foundational practices to prepare students for any learning environment. But I'm also going to cover, I'll just touch on how to address return to school plans, students with IEPs and 504 plans, as well as SOL preparation. One of the first things that we want to consider when supporting our children receiving virtual instruction is to create a learning environment. So try to limit distractions by selecting an area that's relatively free from noise and traffic. It is also important to make sure that your children have all the materials necessary to complete all assignments. Proper rest and nutrition are also essential components to your child's educational success, as is adhering to normal expectations, schedules, and routines used when attending school in person. This creates a sense of regularity and conveys the seriousness of the virtual learning environment. Continue the expectation of eating prior to arriving at class and dressing appropriately. Try to avoid those pajamas and try to avoid having your egg McMuffin sandwich during instruction. Continue to emphasize the necessity of being alert and present during class, and encourage your children to keep the camera on and refrain from engaging in distracting activities such as texting or playing games on their phones during instruction. Check online for grades and missing work, and don't wait for the teacher to contact you to inform you of missing assignments and poor attendance. Ask for assistance if you are unfamiliar with the online system for grade and attendance monitoring. It is vital to communicate with your child regularly about school, but most importantly, about his or her overall well-being. Ask your child how she or he is coping with remote learning, and consider the possible impact that national events, social justice issues, and concerns about the pandemic may have had on your child. Encourage and maintain regular and punctual attendance. Use online tools to monitor your child's attendance in each class. Remain in contact with teachers and the school, and inform the teacher of any changes in your family or living structure that may affect your child. Be knowledgeable of your school and district websites. They provide a host of resources and information. And have your child show you how he or she navigates through the learning management system. If your child cannot navigate through this system with ease, contact the teacher and ask for assistance. Another thing is to be aware of your district's plan to return to in-person instruction. Many districts have already started their return. So you want to be knowledgeable of that date of return to in-person learning. And you want to consider the schedule for in-person learning. Will your child attend 2, 3, 4, or 5 days per week for in-person learning? And will it be a full day or half day? And has the bus schedule been affected? There are several educational concerns parents have regarding students with IEPs and 504 plans. Due to the changes in schedule and the amount of time students are present for in-person learning, the services and accommodations may change in amount, location, and duration. If your child is struggling, please contact the teacher or school to explain the challenges that he or she is experiencing. This may result to changes in accommodations and or services. And when you're requesting accommodations, consider if the accommodations are permitted on SOL assessments. You do not want your child to become dependent on an accommodation that is not permissible on the SOL. And remember, if you can request a IEP or a 504 meeting at any time. Lastly, be aware of the SOL testing schedule, testing locations, and required tests, and refer to the Virginia Department of Education SOL practice site. Now, in the virtual booth, I've compiled a list of resources and website links for general information, summer learning, SOL practice, and tutoring, and educational support for you and your child. So right now, I want to thank you for your time and attention. And if you have any questions, please feel free to ask. I'll be happy to answer any questions you have.
Thank you. Yes, please put those questions in the Q&A. We'll be answering them as we're going along. And obviously those resources are super helpful as we get towards the end of the school year that has been so non-traditional. We're going to head over to Dr. Candice Artis. Please tell us about Candid Consulting.
Good morning, everybody. Again, thank you so much for the opportunity. This is a great segue from Ms. Devaughn's discussion about how students can be successful during virtual learning. But Candid Consulting is an educational consulting firm where we assist students in their quest anywhere from going to post-secondary education to going to graduate study and beyond. So we even have services to assist those students in graduate school completing theses, or those students that are looking to pursue doctoral degrees, as we provide dissertation assistance as well. So it's a large and a myriad of services that we provide. But I'm going to focus today specifically on those students that are high school looking to attend college. I'm going to share my screen. And during this just a little quick snippet, I want to discuss some tools and some plans that students can use in order to be successful during their high school careers. So as Ms. Devaughn stated, being successful on your SOLs, making sure that you're attending school regularly, and also making sure that you're staying on top of your academics is key. But after high school and preparing for what happens after high school, there are some quick tips that I think would be helpful for students in their quest to go to college. So one of the biggest tools that I tell students to use is to create a College Board account. And hopefully everybody can see my screen and you can kind of see the information that's shared here, that the College Board account is free. And it serves dual purposes because students will need to create an account on this website, collegeboard.org, in order to register for their SAT test, which is a test that most colleges are going to require that students take and receive a specific score range. So on the College Board site, students can use resources such as Finding Your College Fit, which is a very step-by-step kind of survey that students can use in order to narrow down and drill down to the colleges that fits their likes and wants out of the institution. And also there are some college preparation timelines that are present on that site that will tell students what they actually should focus on in 9th, 10th, 11th, and their senior year. Those checklists I've actually put into the virtual booth for Candid Consulting. So if you want to kind of see what those checklists are, if you're in any of those grade ranges, that would be a good place to find that information. The second thing that I would recommend that students do is to get a letter of recommendation and actually get several letters of recommendation. This is something that students typically plan poorly because they typically ask their recommenders either the day before the letter is due or a couple of days before the letter is due. And if you're a busy professional, sometimes students don't understand that teachers have a lot of other obligations, not only personally, but professionally, that may not align with their immediate need. So make sure you identify and get to know at least 4 people that can supply you with an excellent letter of recommendation that not only speaks to you as a student, but speaks to you as an overall person, your character, and your work ethic. It's also a good idea to keep electronic signed hard copies of these letters so that you can supplement your scholarship applications or any other types of applications that you may need, so you don't have to keep asking those same people to supply that letter over and over again. Thirdly, I would recommend students, even though we are in the times of Zoom and virtual learning, you have to be active. Even though there may not be a lot of things going on right now personally or in person, it's a good idea to try to be involved in some community service activities, of course, observing social distancing, and also making sure you're doing some things outside of just being an excellent student. Most colleges are looking for students that can be excellent people, well-rounded, and also can juggle their time and effectively time manage. So make sure that you're being active, because a lot of your scholarship applications and your college applications will be requiring that you submit that information. Last but not least, please maintain your GPAs. Okay, try to take courses that have a little bit of rigor. So instead of just taking that general biology class, jump out there and shoot for academic or honors or even dual enrollment. People tend to think that the characteristics of a dual enrollment student is you have to be super smart and have a 4.0 GPA. But honestly, if you have the work ethic and you at least try and you have the persistence, you can be successful even in some of the more rigorous classes that maybe have a little bit more of a difficult stigma to them. So try to take those courses that have rigor. They not only help your GPA, but they also will allow you to go into college with some college credits that will make you a lot more attractive to colleges as they're reviewing your applications. It will also help you to prepare for those gateway examinations such as the SAT and the ACT, which again are used in order to determine your acceptance to many colleges and universities. So if you think you may need some help or you may just have some general questions, my information is also posted in the virtual booth, but it's also here at the bottom of this one pager. You can email me at candidconsultingva@gmail.com or give me a call, and I'd be more than happy to fill any questions that you have in regards to post-secondary education and beyond. Thank you.
And I'm going to ask you one question while you're here before we go on to the next. Is the College Board site for only Virginia students, and I'll take it a step further, people trying to go to out-of-state colleges or anything like that as well?
So the College Board site, it actually pulls in colleges from all across the 50 states. So it's not just for Virginia students. So if you're even not knowledgeable about colleges that may be in California that you didn't even know exist, when you go in and fill out that little survey or that interest inventory, it would actually pull in all of the colleges across the United States that fit your specific wants and needs. So it's not selective only for Virginia schools or for Virginia students.
Perfect. Thank you. And we're going to go on ahead to Dr. Jamel Hodges. Hello.
Hello, everyone. Can you hear me?
Yes, we can. How are you doing?
I want to make sure. I'm wonderful. I was having some technological difficulties. That's why I'm.
It's slowing down a little bit. Okay.
So, thank you. So first off, thank you to the Denbigh Alumnae chapter of Delta Sigma Theta Sorority Incorporated for inviting me. I personally have enjoyed listening to the two panelists before me. Dr. Artis actually took a lot of my thunder, but that's good because I'm going to echo some of those same things. And when we're talking about college access and college admissions and the process and financial aid and the FAFSA and things like that, it's extremely important that you all are knowledgeable about the process. And one of the things that I always preach to my students and families and potential students that I talk to is we are in a different age now, and have been for a while. So in the admissions practices, it's never too early to start. Admissions, colleges and universities are now recruiting students as early as middle school. They're going to the middle schools. They're potentially walking into the classrooms and giving college success or college admissions tips early on. So to echo what Dr. Artis said earlier about the College Board, you don't have to wait until your 11th or 12th grade year. It's actually recommended that you start that process early. You can start in the 9th grade, you can start in the 8th grade if you would like to, but it's never too early to start that process. Starting that process early is the difference between getting into the institution that you want to go to and attending the institution that you were forced to go to. And those are different things. As a student and as a family member, you all are consumers in the higher education environment. And so understanding that the higher education environment is literally built for you, you really want to go where you want to go. You don't want to have to be forced to choose an institution just because you didn't understand the deadlines or you didn't understand the major offerings that the institutions offer. It's important for every student, every friend, to be pushing our students in a direction that they want to go into, to understand their needs, understand their wants, and be pushing our students into getting into that area. Can you all still hear me? Oh, well, and this is my PowerPoint. So it's never too early to start. I strongly suggest, it is extremely strongly suggested that you start early. Earlier, Dr. Artis was talking about those high rigor courses, those dual enrollment courses, those AP courses, those IB courses. Those courses are going to be some of the ones that set you apart from other institutions. Now, some institutions participate in what we know as rolling admissions. Others participate in what we know as selective admissions. Later on in the presentation, is further back. But for rolling admissions is basically where if you meet the requirements of the institution, you're offered admission. So if on the SAT or the ACT, you get the required score and your GPA meets their requirements, you're going to get admitted into that institution. They don't have a select number of spots. They admit students year round, and they don't necessarily have a date where they release decisions on those from those institutions. So they're typically, admitting students throughout the entire academic year. Then we have selective admissions, and this is where a lot of the points that Dr. Artis alluded to earlier are very important, where we're talking about getting recommendations, making sure that your rigor of course load is up to par, and sets you apart from other institutions, or other students. Because when we start talking about selective admissions, that's when we're talking about institutions that do look at those recommendations, and they do look at those essays. And while the SAT and GPA are extremely important, they're also looking at those extracurricular activities, those leadership opportunities that you've taken advantage of and everything. And so that's where there's a lot. And when I say a lot, there is a lot of work that has to be done on the front end. But planning early in the process is the most beneficial situation for you as a student, and for the parents as well. There's a sigh of relief that you will have when you start going into campus visitation periods and things like that. One of the things that I definitely suggest for junior students, don't wait until the end of your junior year to take the SAT or ACT. Go ahead and sit for it. Get a feel for the test. For those rolling admissions institutions, those institutions look at your, a lot of those institutions look at your SAT or ACT scores on a super score basis, basically meaning that they're going to take the highest critical reading or the highest math, or the highest English if you take the ACT, or the highest math on the ACT as well, no matter how many attempts you use, or how many times you take the exam. So they're going to take the highest of those. For a lot of the selective admissions institutions, they require that you make that score in one sitting, especially for your more, I hate to use this word, but it's the truth, but this is what a lot of universities use, but more prestigious institutions, to meet that score in one sitting, which is a little bit different institutions, then you'll know these things going into the test. Another thing to think about when you start looking at your course load, your high school requirements are, and I'm kind of jumping around, I'm sorry. Your high school requirements for graduation will be different a lot of the times from a lot of the institutions, especially out-of-state institutions. So it's very, very, very important that you recognize that your courses that you're taking for graduation will help you and ensure that you graduate. However, you have to understand what courses your institutions that you're wanting to go into, what they're looking for, because some schools require 4 sciences, some schools require 4 lab sciences, and those things are different, right? Some schools look at physical sciences, lab science, some schools don't. So it really depends on the institution. So you have to make sure that you're doing a lot of the work on the front end, as opposed to waiting until your junior or senior year to do some of those things. So now, in submitting the application, submitting the best application you possibly can, it is extremely important that you know deadlines. It's extremely important that you know these TPCs, but it's also extremely important that you do a lot of things that Dr. Artis mentioned earlier, in making sure that you have your recommendations, making sure that you have your GPA up to par. It's correct and test help sites. Those things are extremely important and extremely beneficial for every student who wants to take advantage of them. Another thing that I want you all to think about when we start talking about submitting your application is also thinking about the FAFSA. So I'm going to go ahead and move on to the free application for federal student aid. That free application, again, it is free. There are 3 different types of financial aid. There's scholarships, there's grants, and there's loans. Submitting that FAFSA will help you get all of those depending on your institution. And so one of the things that I want in my virtual booth, there are a couple of resources there for you when we're talking about submitting the FAFSA. The FAFSA opens up, and before I close, I want to make sure I let you all know that the FAFSA opens up for the following academic year every October 1st. Every October 1st. And they use what we like to call prior year. So if you're applying for the FAFSA for the 2021-2022 academic year, you will use your and your parents' 2019 taxes, that 2019 tax information, and that helps you get the FAFSA in as early as you possibly can. And if you're getting your FAFSA in early, it gives your institution the opportunity to process your FAFSA and ensure that you are awarded. Later in the presentation, this presentation is also in my virtual booth. In the presentation, there are a list of links for college preparatory assistance, as well as FAFSA assistance as well. If you want to get in contact with me, absolutely can. My email address is also in the presentation, but it is jamelhodges@gmail.com. That's JamelHodges@gmail.com. And thank you for your time. And I'll turn it back over in the hands of the moderator.
Yes, thank you so much, Jamel. I know you all are giving so much thorough information and practical things people can actually start doing today, which is super helpful. So thank you all for doing that. And I want to go ahead to our final panelists, and we'll get to some questions after that with Lisa Taylor. Please tell us about Virginia Career Works. We can't hear you if you're talking.
How about now?
Yes, that's
okay.
Better.
Sorry about that. Again, I'm just very honored to be here. Thank you so much. Virginia Career Works, we are actually the wonderful career centers that are located throughout Virginia. The Virginia Career Works centers are funded under the Department of Labor, and we're also funded under the Workforce Innovation Opportunity Act. So throughout the whole state of Virginia, every career center is called Virginia Career Works. So you'll have, for example, Virginia Career Works Center Norfolk, Virginia Career Works Center Hampton, Richmond, wherever you live, the centers are called Virginia Career Works. Now, under the Workforce Innovation Opportunity Act, everything I'm going to tell you about WIOA is located throughout the whole country. So no matter where someone lives, they can apply for the WIOA program throughout the whole country. So here in our area, can everybody see the screen? Just wanted to make sure.
Yes.
Okay, thank you. So here in our area, the Greater Peninsula, we have mandated and non-mandated partners that make up the workforce system. So our mandated partners here in this area is Virginia Employment Commission, Virginia Department of Social Services, the Virginia Department for Aging and Rehabilitative Services, Peninsula Regional Education Program, Thomas Nelson Community College, New Horizons, and we are governed under the Greater Peninsula Workforce Board. Now, as of July 1, we are merging with the South Side. So we are going to be also known as Virginia Career Works Hampton Roads. So we also have non-mandated partners who we value just as much. Redevelopment Housing Authority, we have the military employment folks at each base. Also, we have outreach centers throughout the whole Hampton Roads area that we value very, very much. So now we are located at 600 Butler Farm Road in Hampton and right across the hall from the Virginia Employment Commission. And we are free to job seekers and to employers. Everything that we do is free. Our services are for 18 and older. Okay, we are open to the public, and a lot of people think that we are closed, but we have been open. We were only closed to the public after COVID for about 2 months. After that, we've been open, trying to get the word out that we are open and we have plenty of funding. So we're open by appointment, and we have computers, we have access to the internet, we have work-ready workshops that prior to COVID, they were in person. Now they're all virtual, most of them. And we have telephones for folks to use, lots of copiers, and we do career assessment testing, resource materials, and of course, tons and tons of job postings. Now, under the Workforce Innovation Opportunity Act, how it works under WIOA is you have basic career services where you would utilize the services self-directed on your own. You'd utilize our career center. You would attend our hiring events, job fairs, which are also mostly virtual, even though we have started some drive-by job fairs as well. You can utilize the workshops, utilize the center as much as you like. Individualized career services, that's where we actually would assign folks that are enrolled into our program to have a career planner to work one-on-one with them to do more intensive job assistant help. And then we also have training dollars where we actually pay for education and training. We have over 30 some schools to choose from. Our whole goal is to help someone get a career, not just a job. So some of our clients, we pay for education and training. Some may do what's called on-the-job training. Some may do both schooling and on the job, or some clients may just need some intensive job assistant help. So again, our goal is to help someone get a career. Everything that we do is free. It's grant funded. They're not loans, and we have plenty of WIOA money. I would highly, highly encourage anyone that's interested in applying for the program to definitely do that, because you will get a lot of help. Again, our resource center is open. You can go online and you can make your appointment online. You can do it virtually. You can come in person, or you can call the center and do the appointment or make an appointment. We do have COVID. We abide by COVID restrictions where you must wear a mask. If you have one, please bring it. If not, we do have it for you. And we do take temperatures prior to coming into the center. Now, to apply for the program, very, very important, someone has to attend. If you decide you want to apply for the WIOA program and to get a career planner, some funding for school or on-the-job training, you have to attend what's called a WIOA orientation. We have 3 ways that you can do that. You can do it in person. You would call the 757-766-4901 number to reserve your in-person seat. On Tuesdays, in person is at 2 o'clock, and Thursdays it's at 10 o'clock. And Wednesdays, we have a virtual orientation. You now can attend the orientations virtually right through Zoom like we're doing now. You would just click on the Eventbrite link and you would reserve your virtual seat to attend that orientation. or you can do it online on our website. The orientations usually take about 40 minutes, sometimes an hour. Once you do the orientation, you're going to be given some very simple assignments. And once you complete them, then you'll be assigned a career planner, and only your WIOA career planner can tell someone if they're eligible and suitable. So your first initial appointment would determine not only eligibility and suitability, but also what you're interested in and if it's a marketable field in our area. And wonderful program. We have a lot of funding. Very important. You must register in the Virginia Workforce Connection. Very important to do that. Not only will you see thousands of jobs there, but it is a requirement when you apply for our WIOA program. Okay, I know that's a very quick brief, but I wanted to do a very quick overview. I'm available to answer any questions. Also, my information is in the virtual booth. And if anyone would like to also contact me anytime, my email and phone number are listed. Very happy to help anyone. And again, everything that we do is free. Please utilize our service. We do have a lot of WIOA funding available. Okay,
thank you so much.
Yes, ma'am. Thank you very much.
With so many tips during this panel that we can actually put into action, but I do want to at least ask one question, especially for people who are dealing with high schoolers, or even maybe for parents who have kids younger than that. What are some tutoring resources for virtual learning? Or I know we have Mrs. Devaughn with us as well, who has worked with special education. What about parents who kids may need special help with learning and they're doing hybrid learning at home or something like that? Are there resources people can take advantage of?
I would definitely start off with checking with the school district. Many school districts post the names of teachers or other professionals who will give tutoring either for free or for a reduced price. And also in the virtual page, I have a list of educational resources online. Also start with the Virginia Department of Education, super duper resources there. Lots of places that with external links where you can get additional information.
Thank you. Did anybody want to add anything? No? Okay, well, thank you so much. Of course, like we've been saying, all of their information is in the booth, and obviously they're willing and able to help you all find those resources, and Miss Lisa's information is in the chat as well. So thank you to our educational panelists. And thank you for all our panelists. Actually, this has been a great event, and we've definitely had a lot of resources and opportunities to inform people on things that I'm sure all of us didn't know about everything before. So this has been great. And I'm going to turn it back over to Sor Kelly or Keisha.
I do have a quick question for Lisa. Are the paid education programs, are those more for skilled trades, or do they include like 2 or 4 year degree programs?
Very good question. I'm glad you asked that. It's mostly certification, but some can be used for maybe finishing a degree. Of course, the WIOA career planner is the one that could say yes or no, but our marketable fields, it has to be a marketable fields. For that in our area is IT, manufacturing, I drew a little blank. Manufacturing, healthcare. Oh my goodness, can't forget healthcare. Healthcare, manufacturing, IT, and logistics. Very important, but yes, mainly certifications, but some have finished a degree. We're all about finding out what will help that person, our clients, be more marketable in this area. And of course, we would work with the client to find out what they're also interested in doing. We want them to be a success.
Thank you for answering that.
Thank you for that.
Right. And, as Alexis mentioned, we've gained a wealth of information here today. And again, our panelists just giving a snippet of, the services and the resources that they have. Again, we do want to continue to drive you to our virtual booth where all of the information is listed. There's slideshow presentations, any numbers or, events that they have coming up will be shared on that virtual booth. So take a minute to visit that after today. The link for the virtual booth is in the chat, but I'm assuming we didn't have any additional questions. And at this time, we will ask that you complete a short survey for our event. You can launch that for us, Kelly.
It will be in their browser when they exit the survey. It'll also be sent in email after the event for those who were not able to do it or didn't see it in the browser.
Okay. Yes, and definitely take advantage of that if you aren't able to complete it today, that you take advantage of it in your email. And then also, this is a webcast, so you'll be able to access the information again on our YouTube page. So make sure you follow us on YouTube as well. And I will turn it over to the president of the Denbigh Alumni Chapter, Kristen Stansel.
Good morning, everyone. Can you hear me?
Yes.
Hey,
Yes.
Good morning. I would like to first thank all of the participants and the panelists for spending most of your morning with the Denbigh Alumni Chapter this morning for our virtual community resources fair. I'd like to thank the Program Planning and Development Committee for all of their hard work in putting this resource fair together. Thank you again to all of our panelists, guest panelists, and some of our sorors who participated in the panel as well for all of the information that you provided. Very useful information. We are in a pandemic, so any resource that can be provided to the community is very valuable. So I thank you all on behalf of the Denbigh Alumni Chapter for spending your time with us and providing resources from your respective professions and organizations and companies that you all are representing this morning. To our moderator, Sora Alexis Bell, thank you for taking the time out of your busy schedule. I know you're very busy with everything that you have going on in North Carolina, but thank you for being here with us today to moderate this event for us. You've done an excellent job. Thank you so much. Of course, we're proud of you. And of course, Denbigh Alumni is home to you as well. But, we want to thank you for spending your morning with us. And at this time, I will turn the program back over to my soror, Lakeisha Woodard.
Yeah, and just to piggyback, thank you, Kristen. All of the thank yous, thank you for everyone attending. I hope something was, said here today to either help you or to help someone that you know. So yes, again, please share those resources. I do want to thank our panelists for the wealth of knowledge that you have provided, and then also taking your time or sharing your time with us on this Saturday morning. It is, nice outside right now. I know last night was a little shaky, so hopefully we haven't taken up too much of your morning where you can get out and enjoy the weather. I do want to thank my committee for pulling this event together. And those committee members are Kelly Knight, Francis Devaughn, Christy Norwood, Anisha Howard, Margaret Marble Howard, Karen Miller, Ebony Hankins Worthy, Princess Walls, and Bertina Giles Henderson. Also want to thank our tech team, Kelly Knight and Alicia Bell, and of course, last but certainly not least, our Madam President, Kristen Stansel. Thank you for your leadership. So before we let you all go, hopefully you have not jumped off. We do want to do our last round of raffles. So hopefully you are still on because there is a chance for you to win. And Christy, if you can pull up our wheel of names. All right, congratulations, Michelle Jones. You are the winner of a $10 Panera gift card. congratulations, Danielle Burke. You are the winner of a $10 Starbucks gift card. Jocelyn Fisher, you are the winner of a $10 Chipotle gift card. Lisa K. Howard, you are the winner of a $25 Walmart gift card. Congratulations to Almeria Grant, winner of a $25 Food Line gift card. And one more raffle. Save the best for last. And congratulations to Karen Miller, the winner of a $25 Target gift card. And that concludes our raffles. Thank you everyone for, again, attending our event. Again, don't forget to visit our vendor booth and share the information with your friends and family. And also you are able to review the information or this webcast again on our YouTube channel. Don't forget to visit the Denbigh Alumnae website for any of our upcoming events. And we look forward to seeing you at our future events and working with you in the future. Thank you all for coming.